Welcome everyone. This is MnCHOICES office hours for Friday, April the 4th. This slide shows everyone who is in attendance in today's meeting. If they are going to answer a question, they will introduce themselves so you recognize their voice, but they are here to help and assist with the questions that you may have. As you all know, this session is being recorded. We use web audio for you to listen to the session, but we put you all on mute right away. We'll want you to raise your hand to ask a question, and you'll go in a queue in order of the questions asked as best as we're possible to see that. And then we'll call and unmute you so that you can go ahead and ask your question. Please give us a bit of context by stating your name and your organization and who you work for. The reason for that is it helps us get our head around where you're coming from when you ask the question. So it's useful to us to have a little bit more information while we're listening to your question. So let's go over the acknowledgement and ground rules. So we have ground rules in place just to make this call better quality for both of us. So all parties to this call are really here to support an atmosphere of good intentions and respect. The DHS staff is here to provide you information that your agency needs, and your agency mentors are here attending the call to learn and ask questions so they can bring support back to your agency. I ask you to only ask one question at a time, and the reason for that is we really want to get through all of the questions, and then if you want to get yourself back in queue after your question's been answered, that's our preference. The reason for it is just to make sure everyone gets a chance to ask their questions. And in addition, if you've put a question into the help desk ticket, please do not ask it during office hours, because we will ask you, have you submitted it? If you have, then that will get back to you, and that just then leaves less time for other questions. So thanks everyone for following these ground rules. So office hours call dates are all located in the MnCHOICES partner link page. I will soon be updating them for the next year. We set up the office hours slides to go from June to June. So we'll be adding new dates to that. If you have questions for office hours that you would like to get asked, have me answer during office hours, you'll use the submit questions link on the MnCHOICES office hours conference call page on partner link. And I review them about 2 weeks in advance and add slide content based on. So our agenda for today, we have a really large agenda. So the help desk is going to go first, then we'll do system updates, then we'll do some pre-submitted questions, and then if I get time, I'm going to go through the training updates, but if we don't have time, I'll show you where they are so you can go and look at them, and they're also the help center resource updates as well. They are also listed in the release summary for your review too. So Kong, I'm going to have you go ahead and go off mute, and we'll start your part of the presentation.
Sounds good. Thank you. Hello, everyone. I think we have a slide here. Could you go to that slide? All right. So this first one I'm going to talk about is about managing the duplication of the person records. For the past couple of months, we've been working on cleanup efforts to clean up the duplicate records that have been collected from agencies since launch, essentially. So at the same time, we're trying to look at the rate of the duplicates being created, and we're trying to identify mitigation strategies. So while the duplicates, the rate of it isn't that alarming, there's still maybe some mitigation strategies that we could advise for the agencies to keep the number even lower. So the application updates, previous updates, like especially the one in September, FEI has been optimizing the application to make it significantly run better, with the tendency to create these duplicates less. And they've implemented a fix that fixed the some error has occurred while importing too. So that has significantly helped. Um, but we're still seeing a few here and there every month. So I just wanted to take this opportunity to bring it to office hours and just remind people, hey, tell users when you're doing the Teresa, I think you have a next slide. Yeah, when you're importing, and you might want to tell users don't click that import button twice, stuff like that. So with this first slide here, um, it emphasizes on searching thoroughly. I would recommend that users start to search the person record by first name, last name first, um, and see if you find that person first, right? Before you start adding that person, search first name, last name first. I know sometimes you might get like too many records and stuff like that. Well, then you could narrow it down by using the date of birth. I wouldn't recommend searching by inputting the PMI number or the social security number. That's because oftentimes if there's a existing record, the PMI could be different or the social security might be absent. So if you have that social security PMI in there, you might not find that person if that person already exists. Um, Teresa, there's another slide. Okay, so this one emphasize on not clicking the import button. I know that there's still times when you click a button and it doesn't register because it's still thinking in the background. If you happen to click it twice, it's gonna register both of those, and then it's like, for instance, in importing, it's gonna import the record twice. So you're gonna get a duplicate record. So if you click on the button once, it doesn't register. You could click outside of the add person dialog to exit. You can search the person again just to ensure the person hasn't been added. And then you can go through the adding person process again. Mm, that will reduce the duplicates. And I think the key takeaway from this is we've heard from users where you could have multiple users working on a client, right? And so we've had users work in separate profiles, and then they have to manually transfer the efforts over, and that's just a pain. So we want to be able to advise, and so that we can help with that kind of issue. So we are working towards trying to fine tune the adding of a person process to cut down on these duplicates. We are working on that. We're working on trying to make the application function better to prevent these duplicates. And so I just wanted to take the opportunity to bring it out here and advise all of you guys as well, so we could all improve the process and possibly eliminate creating duplicates. So just sharing that with you guys today. All right. Let's see if we have a next slide for the new issue. Okay. So in the last couple of months, we've been receiving a number of tickets for users receiving the some error has occurred. And on the left screenshot there, you can see at the bottom some error has occurred there. And this is specifically happening in the service or support section when adding or editing the service. And then when a user clicks the save button, they get that error message there. And what we found was that, well, actually, we've been working with the vendor, and what they found was that the the error message is very generic, and it was not being meaningful to users, and it could result from various things, such as here I'm gonna tell you guys what they could have mean. So the vendor provided 4 different scenarios what they could mean. One of them, there's when the service date span is outside of the support plan date. The if the error message was thrown correctly, it would say the service date range must be within the plan effective date range. That would give the user an idea what to go and correct. And number 2 there, you see when the user selected is not enrolled for the service, then the correct error message should say the provider is not enrolled for this service. Number 3 there, when the user clicks on get rate before all required inputs are added, depending on the service, the correct error message should be enter all inputs before calculating the rate, or please enter all inputs before calculation. And then lastly there, when the rate limit is exceeded, correct error message should say the rate exceeded the limit for the service. You must make corrections. So at the time the issue is still happening, it, users were getting the some error occurred for regardless if it's one of these 4. But the fix has gone in, so now whenever it's one of these scenarios, they're gonna get the correct meaningful error message now. That's gonna tell the user what needs to be addressed and they can address it. We do understand that there could be, outside of these 4, there could be others. There could be, right? I'm speculating here. So if users are seeing the error message, the meaningful error message, and they're trying to correct, but it's not fixing it, continue to send those into us so we could advise the vendor what needs to be fixed next. And you may still run into the some error occurred. Send that to us. We're still trying to work with the vendor to make these error messages more meaningful to everyone, so we could all, know what to address. All right. I think that's it for this one, right, Teresa? All right. So, lastly here, I did start getting some reports early this morning, on users adding a person, and they're doing import, and it's throwing an error message that says social social security could not be modified. That is new. I have not had time to analyze any of that yet. I'm just giving you guys a heads up. So if you see that going on, send in a help desk ticket, and right after this, I'm gonna start working with FEI to figure out what that is, what's going on with that. So just letting you guys know. Thank you very much.
Thank you, Kong, very much. It's been great to see the vendor FEI systems be responsive to the some error. The help desk's ongoing support, both your and Savannah's support, working through these are occurring with the vendor. So I'm going to briefly go through training and other key updates so that we make sure we have.
Hey, Teresa, you're cutting out again. We can't hear you.
Okay, so is this better, do you think?
Yeah, it sounds good, and then it just stops sometimes.
Okay, well, just every once in a while, just let me know, okay?
Okay.
Thanks. So the updates to training. So we added, with the release for this month, we added the level 2 behavior anxiety field and definition information in training on content MnCHOICES assessment well-being part 2, because that's where that information would be available. So that's been updated to show that the most recent release. We also had some updates for the user manual. We're going to be creating a smart guide reports. It isn't quite available yet, but it should be in the next week or so. The practice guide MnCHOICES assessment version 3 was just loaded to all the environments yesterday, and the practice guide support plan version 4 will be loaded to the system next week. So just so you're aware, and at the very end of this document are the very specific changes and additions that have been made. And if we get time, I'll go through them. If we don't have time, I'll show you where they are in the PowerPoint when we get there. So for today's call, we're going to review items that were released last month, March 6th. The reason for that is because the April release just occurred and there was no way that I would have enough time to get these slides ready and done prior to the release and have them approved. So this is the best that we can do for right now, is to go over the March ones, but I still think they're important and useful to you. So we use the release summary and the CFD version 3.25 for the content for these slides. And we provide you screenshots to help you with your understanding. And please, this presentation sits in the Disability Services Division Training Archive, both the recording and the PDF. And we retain them for 6 months, and then after 6 months, we no longer retain them. So let's go through the items that were fixed that weren't in the CFD for March. So in this instance, what was going on is that this is the person record, and the person record has a view summary button at the top. And what was happening is the information in the tiles in the view summary, the email or the phone number, or even sometimes the information about who that person was getting truncated. It was getting cut off, so you couldn't see it all. With this update in March, now those email addresses and phone numbers display, and that's most important to consultation service providers who this is currently their only way to see who's working with a client. So next item, this one I'm most excited about, and I'm hoping that you were too when it occurred. We've been waiting for this one for some time, and it's great that the vendor found a solution. So in this instance, when someone adds a new staff assignment to a person record, in this instance, we've said assignment type certified assessor. If you were in the application as a certified assessor for your agency and a delegate agency, for example, there were many instances of you and you couldn't tell them apart, and you had to pick one and then you had to see what the location would show after. With this change, it'll have the person's name and then hyphen the organization they work for. So it'll be much easier for you to make sure you pick and assign the correct certified assessor to the person record. So it's a great change. So this next one is about the health risk assessment and the MnCHOICES assessment, that there wasn't an option to select other injectable medication as an acceptable value to manage diabetes. And so with the change, there are now response options that can be choose from. So oral medication or insulation stimulation injection have been separated and replaced by oral medication and other injectable medications. And so then other injectable medications can include insulin or other non-insulin injectables. So again, it is a change that you have all been requesting, or many people have been interested in, and we were able to make. Another change that was made to the HRA, how do you control your diabetes in the diabetes section of the My Health section, has been replaced with a multi-select list, and it includes other injectable medication as a choice as well. But it has a list as overall too, so you can choose which is the best answer. The next item that was fixed that wasn't in the current functionality document is there was a service limit increase to environmental accessibility adaptations, and so it was retroactive to January 1st, 2025. So you can see what adaptations that change occurred for by seeing the changes made here. It lists them for home assessment, home install, vehicle assessment, and vehicle install for environmental accessibility adaptations. The one thing that I forgot to mention at the beginning is if you find this presentation prompts a question for you, write down the slide number and then remind me of the slide number, and I can go back to it when you need to ask your question. So this one is about the MnCHOICES assessment, the functional assessment, well-being and health interventions section. And so you can see that an other box is there. So you can then, text box will display other rather than other select all therapies. So it more, it represents the way that user expects it to look. The next item is from the MnCHOICES assessment results heading. So this is one of the enhancements. I'm sorry, I missed that on the last slide. This is one of the enhancements that was fixed as part of the March release. So the correct case mix wasn't generating when a person was ventilator dependent and the user selected person is over 65 or 65 or older and chooses to stay on a disability waiver, or they had selected person has not previously accessed a waiver and may be eligible for DD in the informed section of the functional assessment under determination. And the result was they were getting a case mix V, which isn't valid for a disability waiver. And with that March release, the system now generates the correct case mix for BI, CAC, and CADI waivers. And then I have a few this is an updated CFD item. So it's in regards to the CFSS to PCA conversion worksheet. And what's important to note is in the CFD, the description, that it's had a title description update, but it's also had an update for the directions as well. And I just tried to make it a little visually easier to read for today's presentation. So basically what it says is the form is only for assessments completed before January 1st, and an assessor must use the form when a person has a PQR or home care rating. And then what it says afterwards is before October 1st, this is what you need to do. After October 1st, this is what you need. So what matters about this is for you to know that that item has been updated, so you can go to the current functionality document and review it and make sure that you have the most updated information. So this item was removed from the current functionality document, and that occurs when we realize that something is functioning as designed, as the application works. It's not a defect. So in this instance, the system will show no option available in the HRA when the user tries to select the name of a person from contacts in member information, in assessment information, and health information. So what this says is the user will continue to follow the directions when a contact cannot be selected in these sections, and the completion requirements were met in the contact information. So what it says is for member information, the emergency contact and guardian fields aren't required. So if they're not available, it's not a required field. The assessment information, select other for who is present at the HRA, and then you can manually enter the name and relationship in. And in the My Health dropdown, the primary doctor is not required when a user enters the text in for the clinic name. So if you put the clinic name in, then the primary doctor is not a requirement. So I wanted to just go over a little bit the contact completion requirements and kind of how they work. So if you have an HRA, so when the contact completion requirements are met before you create an HRA. So in this instance, these are completed and I created the HRA, then that information will come over into the drop-down menu that's at the beginning in the member information section. But if they aren't completed and they're showing in an incomplete status, you'll see that the guardian didn't come over here because it's incomplete. But what happens is once you meet the completion requirements for the guardian, you can do add guardian contact and select them from the drop-down menu. So though it might not copy over, you can then still make it so that you can select it after. So then this is what this says. So if they didn't come over, they didn't copy over, and you need to then add them. So you need to complete the completion requirements for the contact information. So you need to add the address, add the representative type, verify that all of the other information is complete, and then if it is, then you can go to the member information and then add the emergency contact or add the guardian and select them from the drop-down menu. items to the CFD. So users can't create a MnCHOICES assessment form when they're assigned to a person record as care coordinator. This is one that we are working on getting updated so the care coordinators can do it. But right now you still are going to get an error message that says an active certified assessor must be assigned. And you can still, care coordinators still can edit and complete an existing MnCHOICES assessment. And so for right now, you are to assign yourself as a certified assessor as well. And then in a scenario where two certified assessors, county and tribal nation assessor and MCO assessor will need to work in the same record, the first assessor will need to mark the assessment complete and communicate with the other assessor, and then unassign the assessor for their agency so the next start their work. So this one is about when a person is 18 years old and needs tube feeding. The application may not show a dependency in eating. The screening document value is correct. The case mix application does not count eating as a dependency. It determines a case mix. And when does this occur? For when a person is 18 years or older who receives tube feeding, the system may not show a dependency in eating, but it will provide a correct score like it said above. So the CFD then provides directions on how to go about doing that. I won't read through the directions for you, but they are available in the CFD as you can see on the screen. It says you'll use the worksheet, may contact the mentor at the agency for helping determine the case, update the case mix in areas, and it lists them. So the LTC screening document, summary, the assessment results, and supplemental summary chart. This next one, the system does not always show the support plan agreement type develop plan section of the support plan when the program type is CFSS. So the directions are to manually add the agreement type to the support plan and the CFSS type B service agreement printout when it's not shown. So basically in those two documents, you would put in that information. And we wanted to note that this does not prevent the user from closing their support plan. So it doesn't get in the way of completion requirements and make it so you can't close it. You can close the support plan. So effective October 1st, there are CFSS services that should not be used for temporary AC programs. And then to use the appropriate procedure codes like PERS and for specialized equipment, go to the long-term services and support rate limits effective January 1st, DHS 3945, and then you'll be able to find those eligible services for AC and temporary AC. So support plan service agreement, the EN field of the CFSS Type B service agreement is blank when a person is not dependent on a ventilator instead of showing no. And that's the required value for MMIS. So you'll need to manually add the value of N to the EN field of the service agreement printout for MMIS entry when the person is not dependent on a ventilator. So this one is a support plan standard service agreement. A person is not eligible for CFSS program, but has that equal or exceed 10 hours of CSS time per day, the system does not show a yes in the PCA complex field. So the directions in the CFD say in the application, review the CFSS time in the assessment results section, and then manually enter a Y in the PCA complex field on the standard service agreement for all programs when a person meets the criteria for the enhanced rate. So I'm going to go through a few pre-submitted questions and then we'll be ready to take your questions. So if you have some questions and you want to get yourself in the queue, you're welcome to raise your hand. It's just going to be just a few minutes. So bulk assignment, I'm hearing from folks that they're seeing different experiences with bulk assignment, and I was going to demo it to show them to you. A couple of things we're seeing is that for some ways of selecting, you're seeing the blue spinner and the data never loads. And so you're choosing, in that instance, you may choose has staff assignment with a role and has a location, but you won't pick the staff member because either because when you do pick it, it never loads. And so instead you'll do it without it, and then you'll get a big group of people that you have to sift through. And the other thing we're seeing happen is that in some instances, the staff member is showing blank and you can't pick the staff member for your organization. We have reported both of those into the vendor. So if you're like, boy, am I doing bulk assignment correct? If you're seeing blue spinner or no staff member in the drop-down menu, the vendor is aware of it. We have reported it in and are looking into it. So I'll just quick show you. I'm in MTZ, so I don't know what we're going to see for results. So I went to bulk assignment. I'm going to pick query type has staff assignment. Pick, whoops. Site assessor. Pick because it's early on. So it's not showing that's any available. But if I run the query, so then though it doesn't show any staff exist when you run the query, it shows them all. For the agency. And then you have to, of course, do them by alphabetical and scroll your way through them to do assignment while this issue. So we also got a question about tasks. So when you complete a task in a person record because it's been assigned to you and you mark it complete, what will happen is on your task on your My Dashboard, it'll go to 0. So you finished it, you marked it complete. It'll give you a little green box that says success, task completed, and you'll see it get removed from your task list, right? What it doesn't do is remove it from the person record task. It will stay there. It will show it as a status of complete and who completed it and what the subject was. So even though you see it go away for your task, it will continue to display in the task list because, again, this is about the person record. Other thing we were hearing that I believe may be fixed, the other some error occurred issues is that people were seeing some error occurred when adding CFSS services, but they didn't know what it meant. And what we're seeing is when a person is transitioning CFSS and they have a consultation service provider, it appears to be showing up. And it is usually because the PCA service lines are over 6 months in length. So what we would just ask you to do is information. So there's an e-list on the extension of the 3-month period that will make this useful to you and help you to know how to structure the services so you don't get the error, as well as the CBSM or assessment for PCA.
Teresa, you're cutting in and out again.
Oh, I'm sorry to hear it. I will try putting myself closer, but thanks for letting me know, Beth.
You cut out in the middle of that, but we'll keep trying.
Yeah, let me know. I'm getting you a little scratchy on your side too. Interesting. So when the consultation service provider isn't listed in the Minnesota provider screen and enrollment, you'll need to have the provider add themselves or update themselves in the portal. And then when a user cannot choose a consultation service provider in the support plan, you can put them in the people and community organizations that support me. So there's a way to do that. And then it says what you'll need to enter. We thought it would be useful just to provide you the provider screening and enrollment link so that you have it. You may see two error message, provider is not eligible to provide the service or the location must have at least one specialty code. And so it may mean they need to update their enrollment records. So the provider can contact the MHCP provider call center to resolve the issue. It's updated nightly into the MnCHOICES system, but you may see that it takes a couple of days before that update occurs. So we just want that. And before I go to your questions, I got asked another question that I would like to talk a little bit about. There's been some conversation about consultation service providers adding plans to person records, and how do we know if the plan has been added? What is their ability, like what can they see and do in the system? Some of that stuff. So I thought I would show you a couple of things. I have this morning added an Alan Me. He's my MTZ person I use a lot. I've added a CFSS service plan in his attachments, so I'll show you as a consultation service provider. So I'm in his person record. I went to his attachment. And you can see here a CFSS plan, delivery plan, the date, and that I put it in the description. So I can see that as I think I'm logged in as a certified assessor. So I can see that in those attachments, that's how I know. How this has been written is our instructions in there's a help center document called, let's see there. I put in consultation. Called Consultation Service Provider, and it talks about how to attach those plans as well as what to name them so they're easy to see. So they can name them that, attach them to the person record. The other question that I got asked is like, what can the consultation service provider do? The roles and permissions document talks about it, but I'll show you it as well so you can get a sense of it, what they can and can't do. And the reason for it is they have very limited what they're able to do and see. And this will be important for you to know and when you think about how do you work with them. So I'm now logged in as a consultation service provider. I have no one on my caseload. I have to search to find a person. So in this instance, I'll search for Alan Me. That's who I was working with. I can find Alan. I can look at Alan's records. I can go to the view summary to see who the staff are that is working with Alan. And I can also use the messages to message people, to send people information. But I can't go to person's staff records and look up emails and phone numbers. We're hoping to get that changed so that they can communicate more easily with each of you. And we are also looking at providing some training or some additional technical assistance in a future call with those providers to make sure that they have a chance to ask some questions and we can remind them of resources. And so this is more about just letting you know where to expect to see that plan, what it might look like. You can message them in the system and they can use the messages themselves. So that you're aware of that. And you will not see them assigned to a person record because they don't have the ability to assign themselves. So I just wanted you all aware of what that means. So with that, I'm going to let people ask some questions.
Okay, our first question is coming from Beth. I'm going to unmute you. If I can, I'm having difficulty unmuting Anna.
Okay, hang on. Should work now.
Perfect, thank you. Okay, Beth, you're unmuted.
Hello.
Hello, good morning.
Oh, hi. I'm Beth. I'm a case manager at St. Louis County. And a question that comes from my team is, and it may have been asked and answered, so I apologize in advance in previous sessions, but people are wondering why they need to select a need for case management aid in when you add in services that support me. So case management aid has no client contact. So what is the best selection? Even for case management, also I select communication if it's a need, but if it's not, it's like I have a hard time choosing.
You'll just hear a pause for a moment because I'm assuming that SMEs are speaking with each other and how best to move forward. So we'll just give them all a moment.
I can take this one. You'll just want to use your professional judgment. It's hard to say exactly which one to choose because every person has different assessed needs. But you'll just want to use your judgment and choose the one that fits best, depending on the person and what assessed needs they have.
So for case management aid I guess this is my improvement suggestion to make that not a required field, because they're literally doing like MMIS entry and they are not meeting any of a person's assessed needs. So just a thought. Thank you.
Yeah, if you want to send it into the help desk, if you are wanting to make an enhancement request, we would need that sent in through a help desk ticket.
Okay, thank you.
Thank you.
Okay, thank you. Lana, you are next.
Can you hear me?
And
You can, thank you.
Hi, good morning. I am a lead care coordinator for an MCO, and our staff had a question yesterday regarding in the MnCHOICES MCO assessment, doing a CFSS assessment, screening for CFSS. When we have members who need like tube feeding or more of the complex cares, previously in the legacy assessment type, we had that box where we could check for complex PCA, and we would then be able to put in our service agreements and the code for the complex PCA. So our question is, we are wondering, how do we know in the assessment summary results or the supplemental summary chart or any of those documents that this person may be a complex PCA or I'm sorry, a CFSS complex code or some of that matter in order for us to use that code? There's nothing that like it shows in the assessment results or in the supplemental summary chart or anything, at least from what I've reviewed yesterday when I was trying to compare.
thanks for the question. We'll just give them a chance. Beth, I heard you.
I was asking, I'm wanting some clarification. So you're asking about the complex PCA field on a Type B service agreement or on a waiver service agreement?
I'm not sure what a Type B service agreement is, so I would say waiver.
Okay. And what is it that you're wanting to do with, or what's not working, or what? Can you just rephrase your question for me, please?
Yeah,
Yeah,
oh.
go ahead. No, you go ahead.
Oh, okay. I'm just wondering, basically either on the assessment results, supplemental summary chart, assessment summary, like any of those documents that we are needing to send out after, it does not specify on there whether the member is PCA complex or not, or CFSS complex, either verbiage. So I'm just wondering, how do we know whether they are or not? Like, even if we put in that they're tube feeding or, needing routine caffeine or things like that of that nature, there's nothing in the actual results that say, yes, this person qualifies for CFSS complex to use this modifier code kind of thing.
So in your support plan, your instructions to the provider, so your support plan instructions to the provider, you should include that information so that the provider is aware that the person has complex health needs. And it automatically shows on your service agreement.
Correct. No, I understand for the support plan, we can code it, but I'm wondering, prior to us getting to the support plan, when we're doing the MnCHOICES assessment and get the results, like we don't if we don't know, like there's just nothing specifying it from the assessment results that this person is complex, right?
Yeah, so Beth, what I hear her saying is they don't know where to look to find that is the indicator. And I heard you mention something about the service agreement, so go ahead.
Right. Well, and you're right. The enhanced rate complex PCA, as an assessor, you'd have an awareness that when a person has 10 or more hours of PCA per day, that they would qualify for the enhanced rate. So you're right, it's not listed anywhere like in the assessment results, other than it travels over to the support plan for support planning purposes. But again, it's knowing that the person would have 10 or more hours of PCA authorized per day to be eligible for that in certain circumstances.
So if I'm understanding correctly, if we are coding everything in the assessment, say the member has tube feeding and is getting catheter cares like 12 plus times a day. If we are coding that in the assessment is already factoring that in quote complexity in for the PCA time at the end, correct?
Correct, but in order to have complex PCA, you need to have 10 or more hours of PCA per day. So you need to look to see, which I think is.
It's not, okay. So the complex matter is a matter of 10 or more hours. It's not a matter of the tube feeding or the cares like the previous legacy PCA assessment was, correct?
Correct. No, not about the previous. I'm saying correct to that it's not about, it's about the number of hours, not about, complex health needs would contribute to those hours for CFSS. It's not, it's about the number of hours solely, not the cares that the person is getting. So it's the total number of time, the number of time.
Is there a difference between complex and enhanced?
They're the same.
Oh. Okay. It's just very confusing because the complex rate pays at a higher rate than the non-complex rate. So we, I guess, always assumed that the complex was for higher care needs.
No, we might want to take this conversation offline, but we could, but if you want to send in a question specifically about this, we can work to get you some more clarity and some more resources for where you can reference what complex PCA or enhanced rate is, what that is. So.
Thank you.
Thank you. Okay, Sarah. Hi, Sarah, you're unmuted.
Program manager from Olmsted County. And I apologize too if this question has been asked before, but when we are completing the CFSS support plan, it does not come up in an active status. It always says no. Well, I take that back. Sometimes it says no, sometimes it says yes. So I was wondering, are we doing something wrong, or is that a known problem, or I don't understand why it will not be active.
Oh, I can chime in here. So the active status, just completely ignore that. The plan will only show active if it's created during that support plan span. So it's just part of the vendor's core product. It will always be a column. It does not affect your ability to work in the system. You really want to concentrate on the status of the form, like in progress and progress assessment complete, and the plan dates, rather than whether it's inactive or active. For example, if it's a 4/1 renewal and you open it today, it's going to show active. But if you opened it on 3/31 outside of that span, it's going to show inactive. It's just core product. So just ignore that column completely. Focus on the actual dates. So,
okay, thank you very much.
you're welcome.
Okay, Angela.
Oh, hello?
Yep, we can hear you.
Hi.
Sorry, My coworker had to tell me that you said my name. So I needed a clarification, and I'm pretty sure you guys talked about this at one point, but I've just been noticing on the CFSS support plans that I've been doing that there is no like total for services coming up. And I'm just wondering, A, if you're aware of that, and B, what do we need to manually enter that, or is that on the fix list, or what is going on with that?
So is it for a service? Are you just entering in like consultation services?
I finally got my first consultation service to go through with a provider. And that's when, I mean, prior to that, I didn't think it was odd that it wasn't coming up because of the way we were putting it in under that person and supports that support me or whatever that tab is. But now that I actually got the service to go in, like it normally should go in, I assumed I would see some kind of total, and I'm seeing nothing. It just says 0.
Okay. Will you send in an example of that just so that we can take a look at it? There are certain CFSS services that aren't calculated or that aren't included in that total, and then some that are. So I just it would help to see where your support plan is. So if you'd send it in, we could take a look at it.
Okay.
Yeah. Thank you.
Yep.
Okay. Ruth.
Hi. Yeah. My question is, have the consultation services providers been given any direction as far as contacting the lead agency to know that the support plan is in the attachments? We've had some that have come in and we have not been notified whatsoever. And so they might sit in the attachments for several weeks because we're not aware that they're there.
The Help Desk Smart Guide has in it that they should message the case manager to do that. And so if one of the things that I've put on my list is to, if there's an opportunity in a technical assistance webinar to make sure that they're all aware of the Smart Guide and they're aware of how to communicate. If that's something that you have a concern about, you wouldn't be the only person who has said that. So I have lifted that up as a way to support them to improve that for lead
Yeah,
agencies.
because I mean, I had one that came through and it wasn't the provider that contacted me. It was a family member that said, yeah, we met with the consultation services provider last week. And so then I looked and yes, the plan was in, but we've had several others in our agency that I mean, there's sometimes they sit in there for 2 or 3 weeks because we have no idea that they're in there. And we can't go through all of our people every day to see if there's a
Understood.
plan in there.
Well, and that's why I said we've asked them to message in the system. So I will take that one back and work on improving that quality for you by providing some technical assistance.
Okay.
So thanks
Yeah,
for
much
mentioning
appreciated
it.
because
Sure.
yeah, I mean, we don't, because especially if somebody is just going to be starting on CFSS, so they haven't had any PCA or CSG in the past, so we're not continuing that. They're sitting there without services and they might be sitting there longer than what is necessary.
Yep,
Because we
understood.
don't have the chance to okay the plan.
Yep, understood. Thanks, Ruth.
So thank you.
Our next question comes from Erin Bugler.
I was wondering if you were taking questions today about the announcement related to the initial assessment review regarding the 365-day assessments.
typically with office hours, we typically focus on kind of how it works in MnCHOICES and the technical aspect of MnCHOICES. And so we really try not to focus on those policy questions.
Okay. Okay.
Are you wondering about how it might work in MnCHOICES, or you just have questions about it?
Yeah, we were just wondering if the initial assessment review is going to be similar to the eligibility update, or if you're going to have more information about that at a later time.
Amy, you want to go ahead?
Yeah. Hi, Beth. This is Amy. So hopefully you guys can hear me. Oops. Okay. Sorry. I don't know what happened there. We are going to have more information coming out. We're still working on some implementation. I know there was an e-list that came out earlier this week, just kind of introducing the idea. But there's going to be some training and additional e-list that comes out closer to the implementation date, which is 7/1. And so we will have and like CBSM pages and everything updated as it gets closer. So yeah, more to come, basically. We're still working out the details, but we definitely will make sure that you're up to date on it by the time the policy rolls out.
Okay, thank you so much. Appreciate it.
Okay, I am going to go to Sarah Hickman.
Did you say Sarah Hickman?
I did. Hi, Sarah.
Okay, you cut out there on mine. Thank you. I just wanted to, if we could roll back to the consultation provider. Teresa, you had mentioned that messaging would be a good option. And so my questions about that messaging are, I think for our workflow, we want to make sure that the person that needs to be messaged within our lead agency for the service delivery plan is one of the people that are listed. So that's kind of my question. You had mentioned a case manager, but not everybody that is going to be open for state plan services is going to have a case manager in the way I'm thinking case manager. So
you're thinking an assessor may be doing it.
An assessor, or there could be a lot depending on the lead agency. Everybody's kind of trying to figure out how to solve this big problem here.
I'll tell you a little bit about where we're heading. So in the person record, if you go to the My Summary View, it lists people who are working on the plan. Right now, that's the only way the consultation service provider knows who's working in the person record.
Okay.
So they will, if let's say the only person in here is a certified assessor, then they would know that person's email and their phone number, and then they can either message inside, or if they see it here, they could email them directly. One of the pieces we're working on to try to resolve that communication issue is, I'll show you, I can go back, is we're looking at giving them permission to go to assignments so they can see who's been assigned as staff, and that they can go from this assignment to the staff member's profile so they can see their email and phone number. Right now they can't get past here. So they can message in the system if they see the person, but they can't email the person directly or call them and tell them it's there because they don't have permission to see it.
So if you go back to the view summary page, the people that are listed there, where does that pull from?
It is going to be, let's see. So let's say we see supervisor, care coordinator, contracted, and the professional. I'm assuming it's pulling from staff assignment. You can see the ones that are active lead agency.
Hey, Teresa, this is Heather. The staff assignments that are active in there pull into that section if it's a case manager or certified assessor. But those other contacts, like the doctor you see there, that was entered as a contact in the person record in their contacts.
Right. Yep. So if they're assigned, they should show up here. So that would be where we would have them go.
Okay.
Find that
And then
information.
just piggybacking on that, when is there anything that the system does with notifications? Like you know how you might not know this, but like in SSIS, if somebody that's not working with somebody as far as support staff goes in, that individual gets a notification. Is that something that works in the system as far as notifications?
What
When
I would
a consultation provider attaches their service delivery, is there notifications to any of these people on the support team?
I think if that is something that you're interested in, you could put in a help desk request and mark that it's an enhancement that.
Okay.
And then it would be in any instance potentially when an attachment was added, somebody would get a notification. I don't know that it can be specific to that document, but it's definitely something you could ask.
Okay, thank you.
Yep, you're welcome.
Okay. Our next question comes from Annie Ron. Hi, Annie. Are you still there?
Yep, I'm here. Hi. I don't want to belabor the issue with the CFSS plans, but I think there maybe is different information being given to different groups. Because at one point, the regional resource specialists were collecting like a singular contact for CFSS plan notifications. So they were asking for an email that could be used for that. The concern about, I guess my concern about using the support team sort of list there is, I mean, again, maybe likely no case manager, but also the assessor may be long done with their piece. And so that may also not be the appropriate person to be monitoring or reviewing or pulling the plan. And again, that will look different for every lead agency.
Well, Annie, it's good to know that the RRSs are collecting the CFSS contact for the counties, it sounds like. So I'll connect with them to see what information has been under discussion to date from them so that we all get coordinated. So,
sure. Okay.
So I appreciate that. That's useful to me. I wasn't aware of it, so it's nice to know it so then I can then make sure I don't say something that other people aren't saying. So
yeah, I think we've just run into, I mean, where the assessment piece is never ending with the CFSS, and it's hard to navigate that and figure that out because this process takes so long. The assessment piece is often long over by the time somebody's getting to the point of submitting a plan, and it for many counties may not be the same person that is involved with the plan review.
Right.
So,
right.
Okay.
Well, thank you. Thanks. I'll definitely take that under advisement. Much appreciated.
Thanks.
Okay. The next person on our list is Melissa Anderson.
I just wanted to talk about the initial assessment review to kind of go back to that. And as you guys are looking at prioritizing when to roll out communication, I think one of the things that we've had some concerns about is the eligibility update not having that functionality after 7/1. And we've heard that there will be some exceptions to that, but if we could get some information maybe sooner than later on those exceptions, because I think it will impact, if we can't do an eligibility update, it'll impact our communication with our financial departments, which are also, kind of significantly having some delay in processing. And so if we could kind of know if and when, under what circumstances we're going to be able to do an EU after 7/1, that would help us then better have communication with our financial to prioritize cases that we might not be able to do an EU on that really need to have services go, effective back, and to ensure that maybe our financial could process those a little bit quicker or something. So a little bit of information on that as soon as possible would be helpful, because those assessments that we start doing almost right away in May will hit that 7/1 mark at 60 days. So that's coming up quick as we need to make some changes and implement some new things for July. Thank you.
Thanks, Melissa.
Okay, thank you, Melissa.
I can speak to that quickly too. This is Amy.
Oh, go ahead, Amy. Sorry.
Yeah, that's okay. I'll just speak to it quickly. Yeah, and if it's basically if there's a reason that it would need to be to pay for payment of services or things like that, we'll be able to assist with those types of eligibility updates. So if it's needed because the person has been receiving, for example, customized living or something like that, that's something we'll be able to assist with. But there will be more information coming out. If you have more specific kind of questions, you can feel free to submit them to with the help desk form as well, and we'll get back to you.
Okay, Angela.
Hi. Again, I don't want to beat a dead horse like Annie said, but in regard to the CFSS contact, I think it would be most useful to have something like the MICP list we have for counties to use, because that contact person may not always be the assessor, or they may not have a case manager. And I know when we were initially asked this, we had a centralized location we wanted everything to go to, inform people of that, and they've all been coming back to whoever did the assessment.
Okay, that's good to know. I will think about that too from a standpoint of where would we collect that list and how would it get updated if we indeed go that direction. So it'll be a good consult with the RRSs and with the CFS team. Kind of determine what does that look like, where does it go, how do people update it.
Thank you.
Yep. Mm-hmm.
Okay, Keith Peterson.
Yes, I had a question. Just kind of triggered some of the work arounds that we do within the assessment, and then also within the support plan with that 6791K form. So if something still isn't working, and if we had to handwrite it in, kind of with all the changes that have been done, is that going to be practice yet? Or are we not using that form going forward after some of the changes that have happened?
Sorry, I missed the form.
The 6791K. It's a form that was very early on that we had to handwrite information in it, like if we couldn't get something to work, like with the case mix number, or if there was like some kind of an eligibility.
Really what you're asking is, with the changes that have occurred in the MnCHOICES application, is that form being used anymore, or has it been retired?
Yes, exactly. Yep.
Thank you. Yep. I just wanted to make sure that I heard you correctly and give them a chance to talk as policy. So thanks.
Okay, thank you.
Yeah.
So the 6791K is, if you're noticing changes or additions, that yes, you should continue to use that form for handwritten corrections, typed electronic corrections, and something that was printed online from using the browser print. So that is a valid form to continue to use. Okay, Leanna.
I have a support plan question. And I don't know if this is a known issue or if this is normal. If an assessment was done prior to 1/1/25 and you are revising a support plan after 1/1/25, I'm starting to notice that the EW monthly case mix amount does not populate with the new rate. Is this normal because the assessment was done prior to the rate change, or is this a defect?
Chelsea, do you want to take this one?
Do you need her to repeat it again, because that was a bit of information?
Yeah, do you want to repeat your question?
So assessments done prior to 1/1/25 when the rate change, DHS rate change happened. So assessment done prior to that, now we are revising the support plan to add a service or revising it for any sort of matter. The EW case mix monthly maximum amount does not change does not reflect, I'm sorry, the new rate limit amount that has occurred since 1/1. I'm wondering if that's a defect or is that normal because the assessment was not done in the new after 1/1/25 in this example.
If it's something that you feel like you want to look at it a little more, we could have Lana submit it in.
This is Amy. Can you guys hear me?
Can, Amy.
Okay. So the rate change is going to be based on the start date of your tool. So if you're entering in, if you're revising a support plan, you need to change the dates in the in the tool to make sure that they are after 1/1. So if you are doing that, if you're revising a plan and you're changing the date of the tool and you're getting the wrong rates, then yeah, that's something that we would want you to send in. Because the rate doesn't have anything to do with the assessment date.
The rate that I'm talking about is the elderly waiver case mix maximum amount that's on the about overview section in the support plan. Like I'm not doing a rate plan or anything.
Oh,
So
you're just okay. So in the support plan, you're saying it's just that the case mix limits aren't updating in the support plan?
Correct.
Okay. So it's not related to the tool. Okay.
No.
All right.
Wondering if we should just have Lana send it in.
Yeah, if you could send in a help desk ticket, that would be helpful, so that way we could look into it.
Sounds good.
We make sure we're looking at the right place and we're talking about it correctly and all that fun stuff.
Thanks.
Okay, Teresa, we do not have any more questions.
I'm going to take the time to show folks the training changes that are updated, and then while I'm doing that, if you have other questions, go ahead and raise your hand because we should have some time at the end yet. So I just want to make sure that you're aware. After this time for questions slide is then in more detail what's been changed. And so in this training update, what you can see for this content module on MnCHOICES assessment for the well-being part 2 module, you can see that the anxiety related behaviors under the heading level 2 behaviors have been added for the release that just occurred, and that in slide 28 behavioral dysregulation level behavior 2s, there's been a definition added, so you're aware that the training has been updated for the release that happened last night. And then we have created a smart guide for reports. So for people who use it to help kind of guide you on what kind of report you see and how to use that report. We were hoping that it should be available next week or so. If you go into the Help Center for any where there have been updates, and if I mention them and I thought they were going to be available and they're not, it will do it in number order, and so you can function. The CFD has been added, and the practice guide for assessment version 3 has been. So you're more than welcome to go here and see that doc has been loaded. I mentioned it today. I try not to put them in the slides unless we know they're going to be ready, and that one is very close. It's just going final review, so that's why it's been left in my slide deck. The user manual has had a few things added as well. One of the things that's been added is if you send a message from a person record, it will not retain it in the person dashboard. Instead, it will, or in the person's messages. Instead, it will retain it in your messages because you sent a message will be retained in the person sent it to. are aware of that. And then secondly, if a contact isn't available in the drop-down menu, it's because the completion requirements weren't met. That. Oh, and then there's also a piece in here is what happens if you don't know contact's address, and it gives instructions on what to put in.
Teresa, this is
No.
Heather. You're cutting out quite a bit now.
Oh, I'm sorry to hear it. Do you want to talk about this one, and I'll just, or do you feel like you can, or am I better now?
You seem to be better now.
Okay, well, let's just keep trying, and then you just let me know if I cut out again, okay?
Okay, sounds good.
Thank you. So the practice guide for MnCHOICES assessment has had some updates as well. So the acceptance date field was removed because it was covered in a previous release. The I Am Care Coordinator and Need Staying Healthy section, the explanations for the selections were clarified a little bit to make it a little bit easier. The County of Services definition was updated. And then there's a little more clarification about work, school, and work supports section, so you can go read that. And what is considered own, home, or apartment has been clarified, as well as a reference on when a person is living in assisted living or customized living because of the MMIS requirements. So you can go read that as well. And that's posted, so it has been loaded. I just showed you that it had been loaded. There's also updates to the health treatment section to provide examples or clarification on treatments. Clinical monitoring, there was a statement added. Also, clinical monitoring describes tests that are done outside of the medical setting. So, and then mental health treatments, there were some examples that were provided. Psychosocial health level 1 and 2, there includes some notes. So either some more examples. The practice guide is coming. I expect to see it either later today or by Wednesday of this week. So this talks specifically about not using the transition plan when an assessment exists. So use a support plan instead. Also, it talks about the selections for Moving Home Minnesota and other services, because it's better to, if you think the person's going to use them, to select yes because they're not editable. So make sure you select them versus not selecting them if you think it's going to be needed, especially for other services. Our best practice is to tell you to pick yes. If you don't plan other services, it won't matter. But if you pick no, then you can't add them. About plan budget sections updated for CFSS, and a section has been added for a disability waiver. The effective date range, it talks about when a plan is created or revised to not shorten the plan's effective date range unless it's created in error or the person leaves a waiver or a program. And then how to use the plan owner drop-down menu, because that was new functionality since I had created the practice guide. So it adds the functionality in here for the My Support. So when it's an HRA, that the service provider isn't required to plan for the service. That's what this piece is about. And under the service type, services that support me, other services should be added under this service type now. And service lines can be started and ended to accurately represent a person's service. So that's been added for conversation. And then the assisted living verification code was removed. The ordering MPI, enter the NPI the physician has that it has ordered the service, and this is required for services noted. So again, it's just providing that clarification and telling you what's been added. Because often you say, well, what did you update? And so we wanted to make sure you add them. And so the reason code, enter a reason code to generate a notification in MMIS authorization, CFSS fields, the IADL and CFSS representative will display. It'll talk about when and how to delete services in a support plan, because we are understanding that people were having some confusion that they could delete them and how to, so we put instructions in there. For under right modification, there's instructions that were added for AC and EW. Support plan signature sheet, it to how to collect a signature section, and it explains how you can complete details in the section based on the assessment and support plan statuses. So if it's in this status, here's what you can do. If it's in this status, this is what you can do. Materials removed, we removed reference to the DHS EDOC number on my right to appeal. And then there's some more information on getting to the EWRS rate tool. And the section was updated to talk about doing work in it when it's in progress, assessment complete. Because if the step is missed, then the rate inputs and the assessed needs on the printed support plan will be in error, and the person will have to delete the services and start over. So we wanted to make sure we let people know they need to see that status. And then a user must revise the support plan to make edits if it's in plan approved status, and then more information on how to do that. W rate scoring has been updated. I don't know that I need to read through the score updates, but you can know they've been updated and go look at them themselves. And then in the appendix, we added links to documents that support transferring a person from one lead agency to another, so you can go look at those. We put the examples of the MTZ support plans because case managers had been asking about them, so we put them in there so they'll run across them. And then we also added the list of services for Minnesota and other services, all is in an appendix in the practice guide for the support plan. So that is all that I have. Beth, are there any more questions that have come up since I'm speaking?
Yeah, we have a question from Melissa Mack.
Okay, thank you.
Hi, Melissa, you're off of mute. Melissa, we can't hear you. Are you muted on your end?
Can we go to the next person? We've just got 4 minutes left, so.
I think Melissa's our only person.
Okay. Guessing she may have thought she wasn't going to get a chance and stepped away.
Well, she just asked us a question, so I think she might be having some technical difficulties. Okay, I'm gonna mute you and lower your hand. If you figure it out, raise your hand back up and I'll call on you again. That's it, Teresa. Okay, we have a question from Ricky Vane. Hi, Ricky.
This is already answered. I believe it was asked in another MnCHOICES office hours. It had to do with folks that are needing HSS services and are needing a MnCHOICES assessment and a person-centered plan. The question was, what assessment do we do? Obviously, it would have to be the MnCHOICES assessment, but then like what program would we be selecting for that? Does that still fall under the other, or?
For the service of HSS?
Yeah, since they won't necessarily be opening to EW, let's just say if somebody is needing HSS and we need to complete that person-centered plan. So I wouldn't pick, CFSS, I wouldn't pick EW, but I need to have that person-centered plan essentially because they shouldn't be having consultation services if we are creating that person-centered plan and we're responsible to and they're engaging.
Oh goodness, I think that I'm a little confused about the situation where you're completing a person-centered plan because I think that it's just a referral to housing consultation, but I don't. That support plan. Can you maybe submit that question so we can make sure to connect with the HSS policy folks to make sure that we're giving you the right answer?
Okay, thank you.
Thanks, Jackie. All right, everybody. Teresa's audio her audio went out, and so, and we're at time, but we want to thank you all for joining us today, and we will see you next month. Thank you all. Have a good day.